Good afternoon. This is Dr. McDaniel at GYN Corner. Sorry, I'm trying to do two things at once because the front desk was contacting me. Today is Monday, June 17th. Today is Monday, June 17th, and I'm back at it with the presentation I started yesterday on hemorrhoids. So I'll try to give a brief recap for yesterday and conclude it today. If anyone wants more detailed information or to see if there's information that they didn't get, they can look at yesterday's presentation, which was the hemorrhoids part 1. And the presentation for yesterday said it's the most embarrassing because I find that women, they'll have lots of different problems, they'll present and discuss, but they're usually very embarrassed and ashamed to say that they think they have hemorrhoids or to be told that they have hemorrhoids. Hemorrhoids are relatively common. About 40 to 50% of adults, male and female, of course, have hemorrhoids, or some research will state that it's 1 in 20 adults will have hemorrhoids, so it's a little bit lower, like about 20. I guess that's about a 25%, 20 to 25% or so, but it can be as high as almost 50% of adults will have hemorrhoids at some point in their life. And hemorrhoids are varicose veins of the anal canal. We divide them into internal and external hemorrhoids. The internal hemorrhoids are at the very top of the anal canal or the very bottom of the rectum. We can't see those. External hemorrhoids are at the anal opening or the edge of the anus, so they can be seen. And the hemorrhoids are varicose veins of the blood vessel or the venous vascular supply of the anal canal, and they can be symptomatic or they can be asymptomatic. So if they're symptomatic, that means that person is having problems or discomfort. So they either feel a bulge in the anal area, or they feel pain, tenderness, soreness, a swelling, itching, inflammatory changes, discomfort, and those can all be with or without bleeding out the blue or bleeding with bowel movement. Those are the usual scenarios for the symptoms. The things that cause hemorrhoids is anything that increases abdominal pressure. So chronic cough, if someone has asthma, or if they have a pulmonary disorder like sarcoidosis or bronchitis. So any kind of lung disorder that's causing frequent or chronic coughing will do it. Weight gain, especially belly fat versus hips or bottom. So central obesity, anyone over 25 pounds or more overweight, especially if most of it is on their belly. Obviously pregnancy is increased weight, increased abdominal pressure with the pregnant belly. Chronic constipation or frequent constipation can do it, because constipation causes one to bear down and to stress or to strain with bowel movements. Okay. Let's see, those are the most common. Weightlifting, any kind of job or recreational activity that involves frequent or heavy lifting so that you're bearing down, those can all cause increased abdominal pressure and then pelvic pressure, so they're putting strain and stress on the anal vasculature, the blood vessels, so they can cause varicosities. Most people are not aware if they have hemorrhoids. A lot of people who have hemorrhoids won't have symptoms, but they can be seen. Some people will be aware because they'll start to have symptoms, and the hemorrhoids can either be kind of quiet and just sitting there, or they can have the symptoms. They can also get a clot that forms in them because the turbulence or the flow of the blood in the hemorrhoid can sometimes cause a blood clot to form. We call that a thrombosed hemorrhoid. If it thromboses and then it decreases the blood that's able to make it out of the veins, so it blocks off the egress of the blood, that can be extremely painful, a thrombotic or a thrombosed hemorrhoid. And if it gets really bad, it can cause pain and ulceration in that hemorrhoid, and it can cause an ulceration or sore, and it can potentially get infected and be a huge problem. So if a hemorrhoid is exquisitely or extremely painful, or becomes more progressively more painful in a short amount of time, so like in a few hours, 6 hours or so, the person can't sit, then they need to seek medical attention. You can also have a what we call a strangulated hemorrhoid, which is the same thing. The blood supply is cut off. Usually it's cut off by a clot. It could potentially be cut off by just it's prolapsed or fallen out of the anal canal so far that the blood supply, the blood vessel, the vein is trapped. So it's strangulated. Same story. It can necrose, ulcerate, cause potential infection. And then the prolapse is a hemorrhoid, ball of blood vessels. That's a hemorrhoid that has fallen either from the internal all the way out through the anus, or an external one that's really gotten large and it's completely protruding out of the anal verge or the canal of the anus. Those are all the signs and the symptoms and the reasons for hemorrhoids. Treatment. The treatment can be on your own, so a DIY type of treatment. And a DIY will be witch hazel pads. So witch hazel pads are soothing. They'll help decrease the swelling and inflammation to a mild degree. You can sell them pre-made. Those are the Tux pads. That's witch hazel with a little bit of sterile water and a lotion or a scent. Or you can just buy witch hazel and cotton pads or cheesecloth. Soak the cheesecloth or the pad with the witch hazel and apply that to your bottom. You can also sit in warm water, because the heat will help to pull the hemorrhoid back, and it'll help to constrict the blood vessels. Usually heat will dilate blood vessels, but for the varicose veins, the heat will help to constrict them to a degree. And then a lot of people will buy Preparation H. That's just over the counter. It's a vasoconstrictor also, so it helps to contract or to minimize the size of the hemorrhoids, so it'll decrease the pain, decrease the protrusion or the bulging of the hemorrhoid. Those are the biggest ones. Soaking in a tub, the witch hazel, and the Preparation H. Those are usually going to be helpful the majority of the time. If someone has a strangulated or a thrombosed hemorrhoid, those are usually not going to be very helpful. So the treatment for that is going to usually be surgery to either lance a strangulated or a thrombotic hemorrhoid. The surgeon will open it, remove the thrombosis, and cauterize or close up the vein. Or if there are a lot of hemorrhoids, then they'll remove them. So they'll do a ligation procedure for the hemorrhoids. That's usually done either in the office or in day surgery, where the hemorrhoids are removed completely and ligated. It's similar to the stripping that's done on the legs. They can also just thrombose the individual hemorrhoids and remove those if it's just one or two. So I hope that's been helpful information on hemorrhoids, one of the most embarrassing or shameful, perceived shameful entities, medical problems, but they're not. A lot of people have hemorrhoids. A lot of people who have hemorrhoids won't know that they have hemorrhoids until they have symptoms from them, and the symptoms can sometimes come or go. Sometimes patients will come in and say they have a ball or a bump, and they won't know what it is, and it won't be a hemorrhoid, but it'll be evidence of an old hemorrhoid. We call those hemorrhoidal tags. So sometimes naturally the blood supply will get cut off and the hemorrhoid will regress, it'll shrink, but the excess skin that formed because of the dilatation due to the hemorrhoid that was previously there, that excess skin will form a little floppy floppy tag or floppy protrusion of skin, but there isn't any active blood flow in it. So that's called a hemorrhoidal tag. So sometimes people won't know they have hemorrhoids until the hemorrhoid is causing problems, it's active, it's symptomatic, or it's gone and for whatever reason, they've just realized that there was a bump there and they're coming in to find out what the bump is. So thank you for joining me today. Thank you for watching GYN Corner here on Facebook Live, and we have a YouTube channel, GYN Corner on YouTube. The YouTube channel does tend to lag about a week or so behind these Facebook presentations. But everyone have a great day, and I'll catch you tomorrow, Tuesday, on GYN Corner. Thank you.